Good morning. Welcome to another coffee chat. I'm Jennifer. I am a licensed clinician in Kansas, Colorado, and Montana at InFocus Counseling. And today we're going to talk about recovery shock. Sort of what clients will go through as they start making progress in treatment and also start approaching their recovery phase, especially in my specialty of obsessive compulsive disorder. So we're going to chat about that today for our coffee chat. But first, I'm going to make my coffee. So hold tight. Okay, so as I said, we're going to talk about recovery shock. So recovery shock, I would best describe as almost this physical reaction that you feel after long periods of distress. And I'm not just talking about like a few hours or a couple days. Like my clients have been struggling with obsessive compulsive disorder for usually quite a few years. And so after experiencing that constant struggle and distress, and even though they want to feel better, as they start to gain momentum in their treatment and they start to feel the benefits of the work that they've been doing, they start to like sort of feel off, is like the best way that I can describe it as well, right? That like something's different, and yeah, something is different because you've been engaging with your interventions, ERP treatment, you've been implementing the exposure practice, all of the techniques, and things are different because they feel different because they are different. And that's scary. Change is hard. Change is uncomfortable, right? Change is different. And I would say that the change can cause hesitation. Lots of clients will start coming to session and they'll be asking like, is this how I'm supposed to be feeling? Is this what's supposed to happen? All of those things, because they start like questioning, because OCD isn't in control anymore, and so they're in the driver's seat. They have the roadmap. They get to choose where they want to go instead of OCD for all of these past years deciding for them, saying take a left here, go straight. Like, no, you actually don't want to do that. Like, keep going this direction. OCD has been telling you for all of this time where to go, what to do, be afraid of this, do this so that this scary thing doesn't happen. And as you start gaining that momentum in treatment, you start taking back that control. You start putting the decision of like, I want to make this choice. And so I would say like this is a what I call like the recovery shock, that this is new, this is scary, this is different, and what do I do with it? Even though, like I said, they have been striving for these moments since the beginning, since before we started working together. I mean, I ask all my clients, like from session 1, what's your treatment goal? What do we want to be working towards? And of course, like they all tell me in some form or fashion, like, I want to feel better. I want to be happy. I want to be how I was. And I think that those statements do bring up lots of space for us to talk about like what happiness actually looks like. And there's actually a lot of myths around happiness that I like to talk about to kind of like clear the air a little bit about happiness. Russ Harris in The Happiness Trap, I love that book, talks about in like the first chapter a lot of myths around happiness. And the one that I like to, or there's actually two that I really like to like kind of talk about. And the first one is that happiness is our normal state, our constant state. Like that's where we should always be no matter what. And so like that doesn't leave a lot of room for anxiety or anger or sadness. And so that makes, the struggle with happiness a little bit harder because we have this expectation about happiness that in reality isn't realistic. Because we're not making room for all of the other emotions that we feel, the ones that we don't really like to feel. And that's okay. We don't have to like feeling anger or sadness, but we do feel them, and it's important to make room for those. So that one, and then the other one kind of piggybacks off of the first one that I mentioned, that if I feel basically anything other than happiness, then I'm, I think Harris in the novel uses the word defective, I believe. I actually have it right here. Let's see. Yeah. If you're not happy, you're defective. And so I would say, like, once again, that doesn't make a lot of room for all of the other emotions that we are going to feel, and puts an extra pressure on us that, like, if we're not feeling happiness, then something's wrong with me, and that's not true. So I would say that, like, that statement when I get from clients is something to talk about. The other piece that I like to talk about as well is that when we get to recovery, when we're done with treatment, hooray, you don't need to come see me anymore. Excellent. I love those moments with clients. That you're not going to be the same person that you were before. And I think that's hard. There's a grieving process to that, because not only are we different now because of the impact of OCD, but also we're also just different in general, right? Each day we're constantly changing, we're constantly growing, we're constantly adapting to something new. For example, I am not the same person, exactly the same person that I was yesterday. And that's because I'm a day older. That's because life has changed. I've read a different article that has tweaked my mindset a little bit, or I've interacted with somebody differently. All of those things change me. And so I'm not the same person that I was yesterday. And so even though we remember a time where I wasn't struggling, I wasn't in distress as much, and I'd like to get back to that because that's what I can remember. We can't remember the future. The future hasn't happened, and so like we can't remember the future, and so we pull from the past. And so this is a little bit more of like acceptance and commitment therapy, that we're opening ourselves to the fact, and some, like I said, grief. We're opening ourselves to the fact that like I'm not gonna be the same person as I was before this. And I think all of these pieces can happen for a client that's in like sort of the initial stages of recovery shock, that like things are going to be different, and that's okay. It's difference, change, differences, they're uncomfortable. They can be scary because there's an unknown, but it is okay. It is okay that things are going to be different. Things are going to change. You have more of the power. We've taken that away from OCD through your course of treatment. And yeah, like you can make the decision, and kind of hold that, like, and own that power, as a part of like your recovery, that like, yeah, way to go. You got the power back, and you get to live the life that you deserve, and that you desire. Way to go. So those are some of the pieces that I commonly talk about with clients, in sort of this like recovery shock factor that they feel. I would say that like it's an ongoing process, and I like to include mindfulness. I like to include components of acceptance and commitment therapy during this phase, because I think that it's helpful to to continuously have the discussion, to help clients understand like that this can be a part of your treatment, and that's okay. I would also say I include self-compassion components. I include also motivational interviewing components, right? Reminding clients like that, like why we're doing this, why we're at this point, why it's a little bit scary and we can keep pushing through. So I like to use all of those components to help clients through this phase, as they start to settle into having more of their life back. It's raining outside and a big rolling thunder just went by, and it distracted me. So I would say that all of those techniques are helpful, to make room and to connect with the compassionate self, while you're going through this change, because I've said it multiple times already. I will say it again. Change is hard. Change is difficult. I know that we all know that, but sometimes we need to hear it over and over and over again to really allow it to sink in. So, so I would say that's recovery shock. And it's definitely a piece of treatment that I see a lot with my clients that have been struggling with OCD, for a variety of years. And it's a part of the process. It's a part of making room for it. And like I said, utilizing mindfulness, acceptance and commitment therapy, self-compassion work, some grief. There might be a little bit of grief in there. Processing the grief. And also acceptance and commitment therapy, mindfulness, self-compassion, grief. There's one other. I mentioned it earlier, and now I'm like completely blanking on motivational interviewing. There we go. Motivational interviewing. all of those techniques are going to be helpful in this phase, because ERP doesn't stop. You're not done with ERP. It's just that we need to like also make room for this other focus to keep you moving through the ERP process. So let me know what you think. Have you experienced recovery shock, or if you're a provider watching this video, have you seen this with your clients? I'd love to know. Thanks for joining me for this coffee chat on a Kansas rainy day. And I'll see you next month. So have a wonderful day. Thanks.